So by definition, a miscarriage is classed as loss of pregnancy before 24 weeks, while after 24 weeks it is classed as stillbirth. However, it is a personal decision as to whether you view your pregnancy as a fetus or a baby before that 24-week stage. But we're not going to get into that. What we're going to talk about today is why do you keep having miscarriages? Now, you have one miscarriage, and the statistic is 1 in 8 women would have a miscarriage. But then again, you go on to have a second miscarriage, a third, a fourth, and then it comes to the point where you start blaming yourself for the miscarriage. As a woman, you start thinking, is it to do with me? What is wrong with me? And this can lead to mental health problems. This can lead to relationship problems with your partner as well. So let's talk about this. There are several causes for having a miscarriage. The most common cause, as we know, is chromosomal abnormalities, such as birth defects that would mean that the body naturally selects the healthiest embryo for a viable pregnancy. Other causes could include structural abnormalities, maybe the baby or the fetus has got lung defects or heart defects, which again the body would naturally select the healthiest embryo that's going to implant to the womb. And then we start to look at the maternal causes. So we know that with increasing age, there's more chances of miscarriage because again there's less quality eggs. Less quality eggs leads to increased chances of chromosomal or structural abnormalities of the baby. So maybe at 35 years there's a 20% chance of miscarriage. Then at 45 years there's a 75% chance of miscarriage. Then you have infections, whether it's a bacterial or viral infection. That's why during the screening process of your antenatal care, you would normally have a screen for viral infections. It's called TORCH, where you have screening for toxoplasmosis, you have screening for rubella, cytomegalovirus, hepatitis, and other infections such as urinary tract infections that's not been treated. Or it has been shown that bacterial vaginosis that has been untreated right from the first trimester, which has been carried on to the second trimester, can increase your chances of having a miscarriage. Then you also have hormonal causes. It is known that the higher the progesterone, the more your chances of keeping a baby. So if you have symptoms like nausea, vomiting, we usually tell you that that's a good sign. Whereas if you have low progesterone, then you have an increased chance of having a miscarriage. Then certain drugs have been shown or increase your risk of miscarriage. We talk a lot about antidepressants, can increase your chances of having a miscarriage due to the fact that it can cause structural abnormalities in the baby. Drugs like ibuprofen can cause premature closure of the duct, which again affects the heart, which can cause miscarriages in the baby. We also have causes like trauma. Either you've had a really nasty fall or you had a car accident, which means the embryo now detaches from the womb, which can cause miscarriage. And then you have lifestyle factors such as smoking, alcohol, which affect the growth of the baby in the womb, stress, and then medical conditions such as obesity. A BMI of over 30, increases your chances of having a miscarriage. High blood pressure, diabetes, which has been not well controlled, can cause miscarriages. And in a lot of cases, there is no known cause of miscarriages. You've had all the investigations and the tests, and no one can find out why you're having miscarriages. But one cause of miscarriages, which I've not mentioned amongst all the causes, is what we call natural killer cells. Now, natural killer cells are basically lymphocytes. They're a type of white blood cells that help to fight off infections such as viruses and cancer cells by removing them from the body. Now, it is normal to have natural killer cells in your bloodstream and uterus, as they help to prepare your body for embryo implantation and to maintain your pregnancy. So the natural killer cells in the uterus protect the fetus from infections, while the natural killer cells in your bloodstream help to fight off the infection and all the other foreign bodies. Now, studies have shown that in women who had recurrent miscarriages, there were high levels of natural killer cells in the bloodstream and the uterus, which are thought to account for 1/3 of miscarriages due to unknown causes. This means that the natural killer cells look at the cells of the fetus or the baby as foreign bodies, similar to viruses and cancer, and attack them, leading to miscarriage. It is also thought that natural killer cells can occur or increase levels if your body is under stress, it could be stress at work, stress at home, so there is a link between stress and high levels of natural killer cells. Other conditions such as endometriosis, polycystic ovarian syndrome, pelvic inflammatory disease, as well as autoimmune conditions such as thyroid, diabetes, and other conditions. So now the question is, how do I know if I've got this high level of natural killer cells? Well, to find out if you've got high level of natural killer cells, you should be seen at a miscarriage clinic. This is a clinic that deals with women who've had recurrent miscarriages. So we're talking at least 3 consecutive miscarriages in a row. The clinic will be wanting to do blood tests. They would also want to take a sample of the lining of your uterus, known as endometrial biopsy, to help to check the levels of your natural killer cells in the bloodstream and the uterus as well. Now, in terms of treatment, there are different treatment protocols being used, and the aim is to reduce the high levels of the natural killer cells as well as to suppress the activity. So we're talking about medications such as aspirin, which helps to thin the blood, prednisolone, which are steroids, which help to suppress the activity of the natural killer cells, IV immunoglobulins, which also suppresses the activity of the natural killer cells. You have folic acid, which is essential for the growth of the baby, as well as progesterone pessaries, which maintains your pregnancy. Then you have this intralipid therapy, as well as other therapies depending on the miscarriage clinic you attend, which are all meant to suppress the activity of the natural killer cells. So again, I hope this helps. I hope this has been useful. I hope this has given you more insight into what might be causing your miscarriage. So if you're a woman and you've had recurrent miscarriages, do not blame yourself. A lot of cases are due to reasons way beyond your understanding, way beyond what you think you might have done to yourself. Of course, you can control lifestyle factors such as reducing your smoking, your alcohol, trying to lose weight, trying to reduce your stress levels. But if you've got an autoimmune condition, as I said, such as thyroid, diabetes, high blood pressure, again, looking at controlling these conditions and then investigating what other possible causes there might be for what might be causing your miscarriage, such as the natural killer cells. So make sure you attend a miscarriage clinic to investigate further, and you can get the right treatment that will enable you to get a healthy pregnancy that you can successfully see to delivery. Hope you enjoyed this video.